It was back to school today for thousands of Massachusetts students, just as the threat of infection from COVID-19 soars even higher. Here to answer your questions is Dr. Brian Hollenbeck, Chief of Infectious Diseases at New England Baptist Hospital. Dr. Hollenbeck, thanks for being here.
Thank you for having me.
All right, Dr. Hollenbeck, in a lot of ways, today seemed normal. I know it was in my kids' school district. Schools opened, stores are open. Some people still commute into the office. I will tell you the road seemed a little bit lighter than normal than we've seen in a couple of months. So does that seem odd to you that life continues, given what we know is going on inside a lot of hospitals right now? We have increased hospitalizations by 14% just since Friday, and we're quickly closing in on the peak that we saw in last winter's surge.
Yeah, well, we're definitely in the midst of a surge right now. And I think whether it seems odd to me or not it's a hard question to answer. I think in many ways, my kids are still in public school and I plan, they're vaccinated. I hope to keep them in the public school. I think there's real value to that. But at the same time, the consequences, Omicron will continue to spread through the community in many ways. And we're seeing that play out in hospitals right now.
So if you could elaborate a little bit on that, Dr. Hollenbeck, what have you seen so far? What is the impact on staffing at Boston hospitals and yours in particular?
Staffing right now is, I would say, can't be overstated what a problem it is right now. It's worse than it's been at any point in the pandemic, really. We have more people out, today than any other point in the 18 months prior. And hospitals were really across Massachusetts already full heading into this surge with people that had delayed care or the Delta wave from last month. So now, putting this on top of already really strained staffing is something that will be a struggle for at least the month of January and likely beyond.
All right, let's turn to some questions from viewers. Our first one's from Donna. She wrote this, quote, "I received the Moderna booster in early November. Is it true the protection drops significantly after 10 weeks? And I'm guessing she's asking that now because early November was almost 10 weeks ago.
I think overall, I would say that's not true. And the reason I say that is because the vaccines were really designed to prevent hospitalization and death. That's what they were made for. That's what we put them out in the community for. And they continue to do that even after 10 weeks. The vaccines also have a nice side effect of preventing you from getting COVID in the first place, even though that's not really what they were designed to do. And that efficacy does drop off a little bit after 10 weeks. But again, the main purpose of this is to keep people out of hospitals and to keep people from really getting too sick from the virus. And they continue to serve that purpose very well.
And now we have a question from Dylan. He asks, how long does Omicron stay in the air? Does it travel farther than 6 feet?
Yeah, I think to answer that, Omicron is definitely more contagious. And I've seen a lot of cases over the last 2 weeks and done a lot of contact tracing over the last 2 weeks. And I would say that in general, people that are getting sick right now have the traditional exposures. They've been within 6 feet for 15 minutes or more. They live with somebody with COVID, or they went to a party where somebody had COVID and they were unmasked, the normal kinds of things. The difference right now is that the attack rate is much higher. So before you may have been able to get away with that a little bit. Now it's much more likely that you'll end up walking away with COVID in those settings. And that's for several reasons. The virus is more, it gets into cells easier. People that are infected shed more virus. And right now, as we talked about earlier, we're not doing some of the things we did in the other surges to prevent transmission in the community. Schools are still open. Stores are by and large still open. Many people are going around without masks. So it's not so much that it floats farther away from somebody. It's that the whole picture right now is a more contagious virus and room to run in the community.
Okay.
All right, Dr. Brian Hollenbeck with New England Baptist. Dr. Hollenbeck, thanks for your time. Happy New Year.
Thank you. Happy New Year.
Thank you, doctor.